So Dr. Hansen over at Spinal may or may not be new to you, depending on how long you've been watching the show. He's certainly been on in the past, but he has a new piece of equipment and a new program that he's doing that we've never talked about before. So we're going to head out south of town and talk with Dr. Hansen. So Dr. Hansen, I always love to come out here to Spinal because you do such wonderful things for people, and I know you have a new piece of equipment that's probably going to even enhance the amazing things that you're doing. So I'd love you to share it with me and the viewers.
Sure. So we recently upgraded our 15-watt laser to a 25-watt class 4 deep tissue laser.
What's the difference between a 15 and a 25? Like, what difference does it make in the treatment?
Mostly, it cuts down on treatment time.
Oh, okay.
So if we did a 6-minute treatment in the past, now it's 3.5. The idea with lasers, it's not so much the time you spend with the patient; it's more the amount of energy you can put into them. Mm-hmm. So the weaker half-a-watt lasers would take 3 hours for what we do in about 3.5 minutes.
So let's talk about the laser a little bit. What types of things would people come to you? I mean, we know you do spinal decompression, we know you do laser. So when we're talking about the laser and specifically the new machine, what types of things would people be considering using that for?
So it's really focused on getting people to recover from their injuries. So if it's a sports injury, medial collateral ligaments, knee tears, shoulder tears, knee sprains, right. But we also work on people injured in car accidents.
So you're really known for the sports injuries, and that's kind of been what you've become infamous for. So that's interesting. So let's talk a little bit more about vehicle accidents and other types of things that people might get injured from where they would find you to be useful.
So a lot of times people, whether they're rear-ended or they get rear-ended and front-end someone, or they just run into someone, it ends up, it's a sprain strain event of the neck. Oh, yeah. Some people call it whiplash. That's kind of an older term.
A lot of people call it whiplash.
Right. So as you end up tearing the tissues around the neck, you are also at risk of possibly injuring the disc. So deep tissue laser works well on getting the capsules repaired and the torn muscles back to normal. Okay. And sometimes we have to take those people and put them on the decompression tables to fix the disc as well.
So in some cases, people can do both.
Correct.
Okay, so let's talk about spinal decompression a little bit because again, sports injuries, but now vehicle injuries. And give us, just for new viewers that maybe haven't seen you on the show before, just a quick overview of what spinal decompression looks like for somebody.
Okay, so spinal decompression would be someone who has been diagnosed with a disc injury, disc herniation, degenerative disc disease, disc bulging. So they can be chronic, old, long-standing things, or they can be really acute, which would happen in an auto accident. So the idea of spinal decompression is, instead of going for surgery to decompress the nerve root and get rid of the radiating pain, whether it's down the arm or the leg, we put them on a decompression table, and then the table slowly and gradually pulls them apart to create a negative pressure in the disc, which then sucks the disc off of the injured nerve root, and it also gets rid of their arm pain or leg pain, but they don't have to go through the risk of surgery.
And I know it sounds painful, but it's really not.
That's true.
And I've laid on the bed and I've done it just to prove that it really isn't painful. So it's actually kind of relaxing.
It is. People look at their iPads, they spend the 25 or 22 minutes, depending on what we're working on their phones, going to sleep. We have a lady who comes in who just conks out on neck decompression. It's amazing.
That. So what percentage of people just do spinal decompression? What percentage of people just do laser? And what percentage of people kind of use a combination of both? That might be interesting.
Sure. So most of the time, maybe all the time, when we do spinal decompression, we always include the laser.
Oh, okay.
Because it really upregulates blood flow, it upregulates healing, it upregulates collagen repair.
So that's just part of the program?
That is part of the program.
Okay.
Some people come in thinking they need decompression with our consults. And it turns out that either they have hardware, and with hardware you can't use ultrasound because it'll warm up the hardware. But with laser energy, you can actually laser right over an area that has scar tissue from hardware or pain from the surrounding tissues around the hardware. So those people are really good candidates just for laser.
Okay. Now, you do a free consultation.
We do.
And you also have kind of a no-risk guarantee you might want to mention?
Right. So we've been doing consultations for free since we first started doing decompression in 2008. With laser therapy, we don't really need to do much of a consultation. We basically look at their condition, if it qualifies, if it's a torn ligament, sprain, strain, any of that, anywhere in the body. It's pretty straightforward. Those are usually about 6 visits long. We do 3 in a row and then every other day for 3, and that's kind of the recommended protocol from the Light Cure Deep Force Tissue Laser people, which actually coupled us with the NFL Alumni Association.
Wow.
So now if any of our viewers are retired NFL alumni, they can come in and they can receive their first 6 visits for free, paid for by Light Force, And then if there's other ailments, of course, we can talk about further treatment at that point.
How cool is that?
That's like
super
yeah,
awesome.
It's very cool.
That's very awesome. I always love coming here. I've probably done, I don't know, at least 25 testimonials out here, and the things that people say are amazing. I say, if it's free consultation and a risk-free trial, it can't hurt you to try it. So I hope that people got some great information, and if you have any pain, just come check it out. It might work, it might not, but it doesn't hurt to try, right?
Won't cost you anything.
Thank you so much for coming back on the show, and I'm so excited about your NFL partnership and your new laser machine. So thank you guys.
Thank you, Jen.